Okay, so in our previous meeting, we've been focusing on the chapter 3. Okay, yes, and the chapter 3 aspects of research methods is the research methodology. Is that okay? Now, basically, at this level, when we say research methodology, you should know everything that goes into research methodology. Okay, so when we say research methodology, first of all, that is where we do the research design. That is where we look at the study area, which we have treated already. That is where we look at the study sample, under which we have the inclusion criteria and exclusion criteria, which we have treated already. That is where we look at the sample size determination, which we treated when you were doing statistics, especially for your class. It came in one of your eyes. Then we have the study variables, where we have dependent and independent variables. We have the sampling technique, or how we call the sampling procedure, is the same thing. We have the data collection instrument or data collection tool. We have the data collection procedure. We have the data analysis, or some literatures, they call it data analysis technique. We have validity and reliability. But that is for quantitative studies. In qualitative study, we call it trustworthiness for qualitative studies. And then the last one, we have ethical considerations. Okay, so basically, if you are asked to mention the areas that you are going to treat when you are doing research methodology, these are the areas: research design, study area, study sample, under which we have inclusion and exclusion criteria, sample size determination, study variables, where we have dependent and independent variables. Then we have the sampling procedure. Okay, so we can just ask you to state all the areas you have to focus on when you are doing research methodology. What it means is that you have to write out all these 12 areas. Is that okay? Yes. So all these 12 areas comes under research methodology. Is that okay? Yes. So for last year, those who wrote research method exams, we just asked them to write the areas a researcher would cover in writing the research methodology. So the research design, the study area or study setting, the study sample, the sample size determination, the study variables, the sampling procedure or technique, the data collection instrument or tools, data collection procedure, data analysis, validity and reliability, and ethical considerations. Now, beyond this, you need to be able to explain what goes into each area. And also for actual research work, when we talk of research design, how do we write it? That's the most important thing. It's not just about the research method, the theory. Okay. In addition to you understanding what research design is, if you are writing your proposal or you are writing your project work under the research design, what goes into the research design? Okay. And that is the most important part. Is that it's one thing knowing what research design means, and it's another thing knowing how to write the research design in your proposals. Is that okay? Great. And then the study area. So the study area, we've looked at it already, and you can bear with me that it's one thing knowing the meaning of the study area or the study setting, and it's another thing writing it in the proposal. Okay, so if someone asks you what is a study area, you can give a simple explanation. Study area is the geographical area, which could be a district or the immediate town where the research is conducted. But when we ask you to describe study area in the proposal, you see, it's a different thing altogether. Is that okay? And we've done that already. Okay, the same thing applies to the study setting. The study setting is the actual site where the data collection exercise is carried on. So, for example, if you are doing a study at Kolebu Teaching Hospital, okay, yes, in your class, I think someone used Nyaho. If you are doing a study at Nyaho Hospital, which is a private hospital, the study setting is the hospital itself. But the study area is the immediate geographical area where that hospital is located. Is that okay? Great. So it's one thing knowing the meaning of study area, and another thing knowing how to write or describe study area in research. Okay. The same thing applies to study sample. Okay. Then we have the sample size determination. Now, today we will be focusing on, so for your class, we've done the study area, study setting. We've done these two, which is the 3.3. Okay. And I think we've also done, we've also done the study sample. Okay. We've done the study sample. Today, let's focus on the research designs today. Let's focus on the research designs. The research designs. Okay, now with the research design, please, I will advise you to write. Okay, I will advise you to write the research design. Okay, so that I summarize them in a simple way for you. All right. Okay, so previously, you can recall that we looked at research objectives. Okay, now you remember in your chapter 1, you would write some objectives. In your chapter 1, we have two forms of objectives that you wrote. We have the main objective and we have the specific objective. Now, you would also remember that in the chapter 1, the objective, you change the objectives also into research questions. So I taught you how to change specific objectives into research questions. Okay, so in your chapter 1, we have objectives. The objective, we have two forms of objectives, the main objective and then the specific objectives. And we learned how to change the specific objective into research questions. Now, in research, the main reason why you are doing the research, the main outcome, what you are looking for is that at the end of the day, you are going to get answers for the questions you asked in the chapter 1. Okay, so in the chapter 1, you asked some research questions. Okay, you remember from your research objectives, you asked some questions. Let me open a typical example of someone's work. So in your chapter 1, we have the research questions. So these are the objectives. So you see in chapter 1, we have the objectives over here. These are the specific objectives. And then the specific objective, you change them into research questions. We've done all these things already. Okay, now in research, your main focus is the research questions that you've asked over here. You are going to look for answers for those questions. That's the main reason why you carry on projects. Your main focus is that the questions that you asked in chapter 1, you get answers to those questions. Once you get answers to those questions, you are done with your research. Then based on those answers, you make recommendations. That's the whole focus of a research. Now, the question is that, okay, how are you going to get answers to the research questions? What procedure are you going to use to get answers to the research questions? That is where research design comes. So when we say a research design is the overall strategy that you are going to use to get answers to your research questions. That is what we call research design. So when we say a research design, that is the strategy you are going to use, all the procedures that you are going to use, everything you think you can do to get answers to these research questions. So you look at the research questions. We have 4 research questions here. What is the level of knowledge of pregnant women regarding resource incompatibility? This question here, by the end of your study, you should get an answer to this first question. Now, the question now is that, how do you get answer to this question? Okay, and that is where research design comes in. The overall strategy that you are going to use, all the procedures that you think you can use, so that by the end of the day, you get an answer to this very question. That is where research design comes in. So when we say research design, we are looking at the overall strategy that you, the researcher, you are going to use to get answers to your research questions. So when we ask you, okay, what is the overall strategy a researcher will use to get answers to a research question? We are talking about research method, research design. Okay, so when we say research design, the overall strategy that you are going to use as a researcher to get answers to your research questions, that is what we call research design. Okay, you see there is another question over here. So all these questions here, the 4 questions. Remember, these questions are coming from your research objectives. The research questions in your chapter 1, they come from research objectives. So it's the objectives that you change into question form. So at the end of your study, you are just looking for answers for your research questions. Once you get answers for your research questions, you are done with the study. Then you can use those answers to make recommendations. So when we say research design, the overall strategy that the researcher will use to get answers to the research questions. Now, someone can also say research design is like a roadmap. Okay, so it's like a roadmap that you are going to look on to get answers to your research questions. So in some textbooks, they will say research design is a roadmap. Some textbooks, they will say it's a blueprint. Is that okay? Let's go back to the slide again. So you see, the first definition is a conceptual backbone within which research is conducted. That is also a nice definition. Look at the next one. It comprises of the blueprint or roadmap for collecting data, measurement, and analysis of data. Now look at another definition. It's an organized plan for gathering and analyzing data to answer research questions. I consider this definition very simple. Okay, an organized plan, more like all the procedures, all the methods, all the strategies that you are going to use to get answers to your research questions. Is that okay? So the primary reason why you are doing your study is to get answers to your research questions. Now the question is, how do you get those answers? That is where research design comes in. So every strategy you can think of as a researcher, that will help you to get answers. So for example, the questionnaire that you design, you know, the reason why researchers design questionnaire is they want to get information to answer their research questions. Now the questionnaire comes under research design. Your design will tell whether you use questionnaire or you use an interview guide. Is that okay? Great. So the overall strategy that a researcher you use to get answers to your research questions, that is what we call research design. Again, there is another one over here. Look, the research design refers to the overall strategy utilized to answer research questions. The overall strategy utilized to answer research questions. So when we say research design, it's the general strategy, everything, all the procedures that you are going to use, so that at the end of the day, you get answers to your research questions. That is what we call research design. Is that okay? So when we ask you what is a research design, it's simple. In research, you have some questions. At the end of the day, you want to get answers to those questions. Now, how do you get the answers? All the strategies or the procedures you are going to go through to get answers to those questions. That is what we call research design. Now, commonly, you can write this down. This one is not in the slide. Now, commonly, we have 3 types of research design. Commonly, we have 3 designs. Commonly, we have 3 designs. Okay, now the first design, we call it the cross-sectional, descriptive cross-sectional design. You can write it down. Descriptive cross-sectional design. So commonly, we have 3 designs that you'll be using, or that most of you will be using in your research proposals and then your research work. The first one, we call it descriptive cross-sectional design. Descriptive cross-sectional design. The second design, we call it retrospective design. Retrospective study design. Retrospective study design. Retrospective study design. And then the third design, we call it prospective study design. Prospective study design. So the first design, we call it descriptive cross-sectional design. Descriptive cross-sectional design. The second design, we call it retrospective design or retrospective study design. And then the last design, we call it prospective study design. Prospective study design. Prospective study designs. So we have retrospective study design, descriptive cross-sectional design, and then prospective study designs. Okay, there are more, but for now, this is what you need. Okay, and for most of you, you'll be using any of these three designs. So we have descriptive cross-sectional design, retrospective study design, and prospective designs. Have you all gotten it? Yes, have you all gotten it?
No, please.
Yes,
Can we
please.
come again?
Okay, so we have descriptive cross-sectional design, retrospective study design, and then prospective study design. Have you gotten it now?
Yes, please. Thank you.
All right, that is fine. So we have three common designs. We have descriptive cross-sectional design. In some books, they will just write cross-sectional design. Descriptive cross-sectional design, retrospective study design, and then prospective design. Now, let's start with the descriptive cross-sectional design. Descriptive cross-sectional design. Now, when we say descriptive cross-sectional design, it simply means that you are doing your data collection at a single point in time. So, for example, you want to do a study, but then the study, you don't want to use a long period. You don't intend to conduct the study in a long period. Okay? So we use the word single point in time. So, for example, if you decide to do a descriptive cross-sectional design, what it means is that ideally, if you were to be having resources, the study has to be done and finished in a day if you are having the resources that you have. And so in textbook, they use the word single point in time. When we say single point in time, the whole idea is that the study shouldn't take a long period to be conducted. So we use the word single point in time. In some textbooks, they use the word snapshot. Snapshot to tell you that, you see, when you are taking a picture, when you snap the picture, it won't take a month before you get the image. When you snap a picture with your phone, instantly you get the image. That's why some books, they use the word snapshot in time. Snapshot, just to symbolize the fact that that study should be done now, or your data collection should be done now. And for most of you at your proposal level, you are going to do descriptive cross-sectional study, because I don't think someone wants to do a study you finish in 5 years' time. Okay, some people, if someone is doing a study, you start now, and you intend to finish, let's say, 3 to 5 years' time. That is what you call prospective study design, meaning you are doing the study ahead of time. Is that okay? So we call that prospective into future, prospective study design. Okay, but most of you will be doing descriptive cross-sectional study designs. So descriptive cross-sectional study design means that your data collection, as well as all the processes, would be done at a single point in time. A single point in time. Now, usually the single point in time mean you are doing a study among nurses in Pentecost University. When you start, the same day you finish. Okay, but ideally, descriptive cross-sectional study, the ideal thing is that it should have been done. Because of resource constraints and time. Usually descriptive cross-sectional study, let's say a month, sometimes a month to, let's say, about 5 to 6 months, it should be done. Or maximum, you shouldn't exceed a year. Okay, that can be descriptive cross-sectional studies. So your data collection exercise shouldn't cross 3 to about 6 months. Descriptive cross-sectional study. So sometimes some people will use 4 months. Some people will use 3 months. Some people will use, let's say, 2 months. Okay, so you are going to do, and that is what most of you'll be doing. Okay, so in your research, most of you will be doing descriptive cross-sectional studies. Because I don't think someone will want to do a study you use 2 years. Because when you start doing your project work, you have barely 6 months to submit the project. So most of you will be doing descriptive cross-sectional studies. So descriptive cross-sectional study, the idea is that it's supposed to be done within a single point in time. Ideally, it should have been a day. But because of source constraints and sometimes availability of the people you are using for the study, sometimes it will extend, let's say, a month, sometimes 2 months, sometimes 3 months, sometimes 4 months, 5 months, but it shouldn't cross up to more than a year. Once you try to enter up to a year, you are entering into prospective study designs. Okay, so when we say descriptive cross-sectional designs, this is when you are conducting a study at a single point in time, or a snapshot in time. So you can use the word single point in time. You can use the word snapshot in time. Is that okay? So all that means is that you are doing a research. The research that you are doing, you intend to conduct and finish it in a period of, let's say, a month. Ideally, it should have been something like a day. But, practically, that is not possible. Practically, doing something in a month is not possible. But if someone is doing a research and the person writes that I'm using descriptive cross-sectional design, within a space of, let's say, 2 months, 3 months, maximum 6 months, you are done. So you see, that study is not being prolonged. A study like that is what we call, a design like that is what we call the descriptive cross-sectional design. Okay, so I mentioned that when in descriptive cross-sectional design, your intention is to collect your data in a single point in time. Why single point in time? Meaning it's more like you are collecting your data now. You are not waiting to collect your data and finish collecting in, let's say, 5 years' time. When you decide to do that, that is a prospective study design. Okay, so when we say descriptive cross-sectional, meaning the whole idea is that you are collecting your data now. Is that okay? You are doing your data collection now. Then we say you are doing descriptive cross-sectional studies. Okay, then we have what we call the retrospective study designs. Retrospective study design. Now, the question is, what is retrospective study? When we say retrospective study, sometimes some people will decide to do studies. The nurses or health professionals have already collected the data. Then they will go and review the information that is already existing. In such a situation, you are doing retrospective studies. So in retrospective studies, you review records. Okay, so if someone tells you, I'm doing a retrospective study design, that person will not collect data. The data is already there. So the person will just go to the hospital and then review the already existing records. So for retrospective study, you are looking backwards in time. You see, cross-sectional study, you are looking at now. Now, you are collecting your data now. Retrospective studies, you are collecting your data from the past. That means that you review past records. So if you go to your hospital, you want to do a retrospective study, what it means is that the records that are already there. So I can say, I want to do a retrospective study to know the number of admissions that were done in my hospital between 2022 and 2025. You see, that data, that information is in the past. So if someone decides to do a study like that, they are doing what we call retrospective. The design is a retrospective study design. Okay, so when we say retrospective study design, what it means is that they are going to review information from the past, or they are going to collect data from a past, an existing record. Someone can say, okay, I want to go to Mamprobi District Hospital, and I want to go and collect data on the number of admissions that they had between the year 2020 and 2024. Now, you agree with me that that information is already in existence. If you decide as a researcher to go and collect data on an information like that, we say that you are doing retrospective study design. Now, another example, we can come to Pentecost University and decide that, okay, we want to take records of the number of students who reported to the sick bay between 2024 and 2025. So you can go to the sick bay and say, okay, I need records of the number of students that came here between 2024 and 2025. You see that information. You are not the one going to collect that information. It's already in existence. You are going to review records. Now, as a researcher, when you decide to do a study like that, we say you are using retrospective study design. So in retrospective study design, the information is already in existence, and you are going to review past records. Then we say you are using retrospective study design. Now, that design tool can be used for you, your level. That design tool is accepted. It's accepted at your level. Okay, so records that are already in existence and you want to use it for your study, it's accepted at your level. And we call that the retrospective study design. So when we say retrospective study design, it means the record is already there. You want to do a study and you want to pick information from records that are already in existence. So if I decide to go and do a research in a hospital, but I want to collect data from informations that are already in existence in the past, then I say that you are going to use retrospective study design. But this design will have some disadvantages. It will have some disadvantages. One of them is that it is very possible you would have incomplete data. It is very likely you can have incomplete data. For example, you want to review data on the number of cases that reported to a particular hospital. Let's say you go to Dansoman Polyclinic and you ask them that you want to do retrospective studies to get the number of admissions that came to the hospital with malaria as the condition and were diagnosed of malaria. Now, probably that information that you want, the patient, you need their religion. Probably the nurses did not take their religion. So what it means is that you are going to get incomplete data. Is that okay? It could also be some of them, they collected their religion. Some of them, they didn't collect that information. So at the end of the day, you are going to have a lot of incomplete data. But if you were doing descriptive cross-sectional study, you would have the opportunity to collect the information yourself, because that one, you collect the data now. Is that okay? So one of the weaknesses of retrospective study is incomplete data. Again, another weakness is what we call selection bias. Selection bias means that when you go, you'll be forced to select certain information that they have. Not necessarily information that would strategically position your research better. You'll be forced, you'll be compelled. What they have is what you'll be compelled to select. So there will be what we call selection bias or researcher selection bias. So for example, when you go there, you go and look through their records. The things that are there, you'll be compelled to work with the things that are there, whether or not they would make your research better. So you'll be compelled that, oh, this is the information they have. Let me work with them. Okay, and that will cause researcher selection bias. Okay, so retrospective studies will have two common advantages. Incomplete data. The data may be incomplete. The data may lack certain elements that probably you may have indicated that may be useful for your study. Is that okay? Again, there may be selection bias. What is selection bias? Selection bias because you are not the one who collected the data, and the data have already been collected. When you go, probably there are certain informations that you need, but you would only be forced to select things that they have. Is that okay? Because retrospective, the data is there. You are not the one going to give your questionnaire out to collect the data. The data is already there. So when you go, you'll be forced to select from the things they have. So there will be selection bias. Instead of selecting from things that can help your study, you'll be forced to select things that are already there. Okay, and that is where selection bias comes in. Is that okay? You'll be forced to select information that are already there. by force, because you are not going to be the one. For example, let's say as part of your study, you are doing a retrospective study. You need the ages of patients. The nurses did not collect their ages. You'll be forced to collect the things they collected, to select the information they selected alone or they collected alone. Is that okay? That is where researcher selection bias comes in. Okay, so that's retrospective study. So what is retrospective studies? The information is already there. You want to do research and use information that is already there. Okay, and we have some students that are doing, I can count about 15 students that are doing retrospective studies. Okay, the information is already there. All they will do is that they will go to the hospital. Then they will go and collect information. So they will there are some midwives that are doing retrospective studies. So what they do every day, they will go to the hospital, the antenatal clinic. They are looking at complications. They are looking at the pattern and type of complications that are reported by the pregnant women. So every day they go to the antenatal clinic. Then they go through their past records. So they are looking at 2023 to 2025. So they've started. So from 2023, they take the records, the antenatal books. Then they'll be going through, okay, pregnant woman 1. Okay, what condition did she report it? Did she come with some complication? Then they write the complication down. They write her age. They write her sex. But you see, the record, it could be the nurses that were there, the midwives that were there at a particular day. They forgot to take certain information. So it means you are going to have a problem with data completeness. So all that means is that some of the patients, you have to skip them. You can't use them. Because if the patient's age was not collected, if the patient's sex was not collected, and you need that in your study, it means such patients, you can't use them. You can only use the patients that have the complete data. Is that okay? That is what we call retrospective study design. So if your group decides to do retrospective study design, all it means is that you would collect data from existing records. So if someone asks you what is a retrospective study design, there's a type of design where, as part of your data collection, you are going to review information from already existing records. So meaning you are studying into the past. So if someone tells you I'm doing retrospective study, it means they are studying backwards. That's why we use the word retrospective. Retrospective, meaning you are studying what? Backwards in time. Okay, that means you are reviewing what? Existing records. What are the disadvantages? The disadvantage is that you may suffer from what we call selection bias. Why selection bias? Selection bias because your study may have certain elements you want to cover. But with this design, when you go, you only be compelled to select some things that are there, not what you want. So, for example, if you go to Dansoman Polyclinic, you want to do retrospective study to know the typhoid fever cases that reported in the hospital in the year 2024. Let's say in your study, you want the residency of the patient, but the nurses did not record the residence. You'll be forced to write or work with what they recorded. Okay, so there can be selection bias. Okay, and also you would suffer from what we call incomplete data or incompleteness of data. What does that mean? That means that for some of the patients, it could be the nurses that were recording that they were not competent. So they write the patient's age, they forget to write the sex. And it happens, you can recall. Sometimes patients come on admission. Sometimes you even forget to write the diagnosis in the admission and discharge book. Check. So sometimes you check, some people will even forget to write the dates on admission. It's another nurse that sometimes they may even have to come and write. Sometimes even on the daily ward state, someone may even forget to write the patient's name, the diagnosis, the date of admission, the sex, the age. Some people will forget to write. So if you are doing retrospective study, you can be limited by incomplete data. That's a disadvantage. You'll be limited by what? Incomplete data. Is that okay? As compared to cross-sectional. Cross-sectional, you are now doing it. So you would have the opportunity to collect whatever you want. Cross-sectional. Okay, so cross-sectional is where you do your own questionnaire. Okay, for retrospective, you'll be compelled to work with what is there already. You can't go beyond what is not there. Is that okay? Great. So that is retrospective study design. Okay, good. So we've looked at retrospective study design. We've looked at cross-sectional design. Let's look at the last category, which is the prospective design. Prospective study design. Prospective study design. What do you think the prospective study design will be? Yes, what do you think the prospective study design will be? Yes, who have an idea?
I have an idea.
Okay, go ahead.
So that design will be the combination of cross-section design and retro section design.
Not really. Not really. It's not a combination of both.
Sir,
Yes, go ahead.
please, it's a data collection done ahead of time.
Ahead of time, that's the word. So it's not a combination of the two. Here is a data collection design where you are looking at conducting your study ahead of time. So in some tests, they use into the future. So retrospective is past time, meaning history, back in time. So some tests with retrospect, they use the word back in time or backward in time. Prospective means forward in time or ahead of time. Okay, so we use the word forward in time. Now, all these studies, for you to understand, is the time direction. The time direction. Cross-sectional, what is the time direction for cross-sectional design? Yes, what is the time direction for cross-sectional design? Yes.
They're like now.
Now. Cross-sectional, that's why we call it cross-sectional now. You see, cross-sectional, meaning now. That's why they use the word snapshot. So cross-sectional, I want the information now, today. If I'm doing cross-sectional, ideally, if it is today, I want all my information today. But because of time constraints in our setting, and sometimes you can imagine your group, let's say you are doing research among 200 pregnant women. You are doing cross-sectional. Ideally, should have been a day. But do you think 500 women, pregnant women, you can get all of them at the hospital in a day? No. But ideally, cross-sectional design is now. Everything in the study, including data, it should be done now. That's why they use the word snapshot. Okay, so in most textbooks, when they are defining cross-sectional, you see the word snapshot. Snapshot in time to tell you that it's symbolic to when you are taking a picture. When you take a picture, the image is generated on your phone the same time, instantly. That is cross-sectional. Now, prospective, into the future, meaning ahead of time. So if someone is doing prospective study, the person can take 2 years up to about 10 years. Then we say you are doing what? Prospective studies. Okay, and I don't think any of you, any group want to do prospective study. You can't do prospective study at your level. Because prospective study is going to take about 2 to 3 years, sometimes 5, sometimes 6, 7, 8, 9, 10. Someone can even choose to do prospective study for 15 years. Okay, you don't do prospective study and collect your results today, now. No, your results will be collected in the future. Say 3 years, say 4 years, say 5 years, say 6 years, say 7 years, say 8 years, say 10 years. Prospective studies. Is that okay? So prospective studies, in prospective studies, you are doing it ahead of time. Is that okay? Ahead of time, meaning into the future. What do you think may be a disadvantage? Think about it. What do you think may be a disadvantage? You are doing a study 5 years, 6 years, 7 years, 10 years. What do you think may be a disadvantage?
Sir, if the person dies.
Come again. Come again.
If the person that you are used to do the study pass out or die.
Yes, it's a good point that you've raised. In research, what you just said is good. It shows that you are really thinking about what we are discussing. So in research, what you just described, in research, we call it loss to follow up. So you see the same idea you just mentioned. in research, that description you just made, we call it loss to follow up. That's the meaning. So you can have what we call loss to follow up, because the people you are studying, it's not even about they dying. Someone can, at a point, prospective, someone can say, me, I'm tired, I won't do the research again. Those people too are also lost to follow up. Someone too can die. Someone too can travel. Do you get it? For example, let's say Pentecost University students, let's say you want to do prospective study among, let's say, level 100 students. You want to study them for, let's say, 4 years. You know, within 4 years, someone can be sacked from the school. Someone can take transfer. Someone can travel. Someone will leave the school. Is that okay? Someone, probably because of results, someone may, you know, quit from the school. People, some too may go on suspension. Is that okay? Yes. So with prospective studies, one of the disadvantages is what? Loss to follow up. Is that okay? Loss to follow up. So when we ask you what are some of the disadvantages of prospective study, loss to follow up. Any other disadvantage you can think of?
It's time consuming too.
Good, time consuming. You can imagine you are going to do a study for 5 years. You are going to do a study for 6 years. You are going to do a study for 7 years, 8 years, 10 years. Time consuming. Is that okay? Time consuming. Okay. It's time consuming. Okay, so prospective studies are time consuming. Okay, so one of the disadvantages of prospective studies we have is time consuming, and then there's a risk of loss to follow up. What does that mean? Some of the participants you are using, some may die, some may give up, some may get fed up and they may quit. Is that okay? Some may decide not to be part of the study again. But imagine if it was cross-sectional. Cross-sectional, the same day you finish collecting your data, can someone say, I'm quitting? You are done collecting your data, you've left, you've gone. Nobody can come and say, I'm quitting from the study. But prospective study, because you are using them for about 5 years, someone can say, maybe in the mid-study period, someone can tell you, oh, me, I won't continue again, I'm tired. Someone can travel, so you would have what we call loss to follow up. Is that okay? Loss to follow up. But what do you think will be some of the advantages?
Madam,
What do you think will be some of, yes?
Please,
it
can
gives
you
much time for the person to gather more information.
Yes, you can gather. It gives you time to gather more information. It gives you time to gather more information to help you understand the effects or the relationships in your study. It gives you time to gather more information or detailed information. Is that okay? Now, it's giving you time to gather detailed information. In research, we say that it establishes what we call cause to effect. So that explanation that you mentioned, that it gives you more time to establish more information or detailed information. In research, we call it establishes what we call cause to effect. Is that okay? It helps you to get detailed information about the concept that you are studying. Meaning, whatever variables or relationships you want to study, it will give you an idea to understand them temporarily. Okay, yes, and that is how we call it in research. Okay, again, another thing prospective study will do. Yes, you wanted to say something.
Yeah, I wanted to ask that with the disadvantage, the funding, like won't there be a high cost?
Yes, there can be high cost. Resource constraints can be a challenge. Okay, resource constraints can be a challenge. Yes.
please consider disadvantage? Can you say discontinuation of data processes?
How? Can you explain further? But I think all that will come under the loss to follow up. All that comes accumulating to the loss to follow up. So when we say loss to follow up, we are talking about a participant can choose to stop at a point in time. A participant can say, oh, me, this study, I'm tired, I won't do again. And that will cut your data short. Do you get it? A participant too can say, a participant can say, okay, for me, I'm traveling. That will also cut your data short. Is that okay? Even you, the researcher yourself, at a point, it can happen, something will happen, you travel. You shouldn't think about the participants alone. The researchers themselves may even die. So don't be looking at the participants alone. So there can be a cut short of the study itself. But in research, we classify all that under loss to follow up. So when we say loss to follow up, all those things comes under the loss to follow up. Is that okay, please?
Okay, sir. Thank you very much.
That's fine. That's fine. Okay, so what are some of the advantages? So we've mentioned another advantage of prospective study. We have something we call recall bias. Okay, recall. It reduces recall bias. That's one advantage. It reduces recall bias. Okay, it reduces recall bias. Okay, that's one advantage of.
So what about it minimizing the selection bias?
Oh, we are having an unusual feedback from someone's line. Who is that?
Can you hear me?
Yes, we can hear you. Go ahead. We can hear you.
I said, can it also minimize the selection bias as well?
Yes, it minimizes selection bias because prospective study, you have the opportunity to even change certain things as the study goes on. So it minimizes selection. In fact, prospective will help minimize several kinds of bias because you have the room to do a lot of corrections as the study progresses. Okay, so prospective study can reduce selection bias. It can also reduce what we call recall bias. When we say recall bias is about sometimes when you are especially in retrospective study. For example, you want to do a study among, let's say, tuberculosis patients. So let's say patients who have suffered tuberculosis before, and you want to ask them questions about their past. Then you ask them, okay, so let's say we go to the hospital. Then we select 10 patients who have suffered tuberculosis before. Then we ask them, okay, let's say we are doing the study in 2026. Then we ask them, in 2023, did you ever smoke? Okay, did you ever travel to a place where tuberculosis was common? Did you ever travel to this region? Did you ever travel to any country? You see, some of them may forget certain things. Recall. They may not be able to recall the information. You see here, it's retrospective because you are asking them questions in their past. So it's retrospective. Now, retrospective study may have one disadvantage, which we also call the recall bias. It's also a disadvantage in retrospective study. Some of them may forget. They will forget the things. So they may give you some information, but not all. For example, if you are doing a retrospective study, maybe you come to my house and you ask me, okay, in 2019, when I was a student, probably in let's say, let me use an example, let's say junior high school. Okay, which time do we close? If you ask me that question, probably I can give you some information, but it may not be exact. Okay, and that is what we call recall bias. Because you are picking the information in the past, the participants may not be able to give you the accurate information. Some of them they will forget. That's where the recall bias comes in. So retrospective study has a disadvantage of recall bias. But prospective study, because the participants have more time, sometimes they may forget certain things. Along the line, they can remember and come and tell you that, oh, this one I said this, but no, it's this. So you have the room to make corrections along the line. So we say prospective study help to reduce what? Recall bias. Is that okay? It helps to reduce recall bias. Okay. Yes. So what are some of the advantages of prospective studies? Yes. What are some of the advantages of prospective studies? Yes. What are some of the advantages?
It gives us information ahead of time.
It gives us information ahead of time. That is more like the definition. What you just mentioned is the definition. Yes. What you just mentioned is the actual definition of prospective studies. We want the advantages. I've mentioned some of the advantages. Yes.
They can give you accurate data collection.
Good.
Like
It's likely to give you an accurate and complete data. Yes, I like that point. It gives you complete data. Okay, so a disadvantage of retrospective can be an advantage for prospective, because prospective, you have more space. So let's say you are doing prospective in Korle Bu. You went home, let's say day one, a particular patient, you didn't take their age. You have the opportunity to go to the hospital or go and meet the patient again, because the study is 10 years. The study is 5 years. Unless maybe the patient die, where you have the loss to follow up, that you not get information. But once the patient is alive, you have the opportunity to get the information. So you would always get an accurate and complete data. Is there any other points that I mentioned? We've mentioned about 3.
Please say it reduces stress.
It reduces stress? No, it's not a strong point enough. It's a good idea. You have an idea. All research will stress you. Retrospective is stressful. Cross-sectional is stressful. Prospective is stressful. It's fine. It's fine you are thinking in that direction. But all research will stress you. All research comes with stress. Hey, proposal alone, even the research course alone is stressful. So all research, no matter the design, is stressful. So it will not necessarily reduce stress. Yes. So what are the advantages? Yes.
Can you say it gives room to test the hypothesis?
Yes, it will give you enough room to test the hypothesis. That is great. Yes, it gives you enough room to test your hypothesis. Yes. So what are the advantages? I've given you 3 advantages. So that is what I want. What are the advantages of prospective studies?
So you said it reduces record bias.
It reduces record bias. That is 1. 2.
The selection bias.
So you said it gives details.
Good. It gives you detailed information. Apart from that, it will give you complete data. Is that okay? Complete data. Am I the only one having the unusual feedback?
No, I think we also have no.
Okay. So it gives you complete data. So if you are doing prospective study, you are likely to get a complete information. Because let's say you are doing prospective study among patients, among residents in, let's say, La Paz. Let's say day 1 you went, you collected age, you forgot to collect nationality. Day 2, when you go, you can go and collect, because the study is 10 years, unless the participant dies. So you are likely to get a complete data completeness. And it will also reduce record bias. It will also reduce data selection bias. Is that okay? Good. Any other thing that we mentioned? Okay, what are the disadvantages of prospective studies?
So you said lost to follow up.
Good, lost to follow up. What does that mean? When we say lost to follow up, what does that mean?
To my understanding, moving forward, the researcher may die along the road, or the people that are doing research on could back off and tell you that they don't want to do it again.
Good.
That's how I.
Good. Any other points? Some may travel. Okay, some may travel. Yes. Some of the participants may die. Some of the participants may even suffer serious condition or serious illness that they may not be strong enough to take part in the study. And in research, we classify all that under loss to follow up. So if you put those points into 3, we see it as 1. So when we say loss to follow up, if a participant die, if you, the researcher yourself, you travel, or you, the researchers yourself, you die. If a participant decides to withdraw, all of them, we classify it under loss to follow up. In research, that's what we call loss to follow up. Is that okay? So there can be loss to follow up. Okay, that's one of the disadvantages of.
And so it's also time.
It's time consuming. Is that okay? And we can ask you all these things in an MCQ question. So if we ask you, which research design is commonly characterized by loss to follow up, and of course you know that we are talking about prospective study design. It's commonly characterized by loss to follow up. Which of them is time consuming? So between prospective, between cross-sectional and retrospective, which one is time consuming? Usually it's the prospective study designs. Very time consuming. Okay. Which of them is characterized by incomplete data? Which of them do you think you are likely to get incomplete data? Yes. Retrospective study designs. Retrospective study designs.
So you said the retro.
Yes, retrospective study designs. Retrospective study design. Okay, which of them is likely to reduce incompleteness of data?
The prospective.
The prospective study design. The prospective study design. Now, cross-sectional too will give you the room to complete data, because cross-sectional, you are collecting the data now. So you collect what you need. Is that okay? So cross-sectional too can reduce incomplete data. Which of them is likely to reduce or minimize selection bias?
Prospective.
Cross-sectional too can help you to achieve minimizing selection bias, because cross-sectional, you are doing it now. So what you need is what you collect. You'll not be bound to collect from what is already existing. Okay, so cross-sectional too can help minimize selection bias. Okay, so now you understand the three common designs. These are the three common designs. So we have the retrospective design, study design. We have the descriptive cross-sectional design. And then the last one, we have the prospective study designs. Okay, and usually most of these things, you see them in MCQ questions. Okay, great. Now, the next thing we will talk about is, now we've looked at study designs. In some textbooks, there are other designs, okay, but those designs are actually data collection approach. So write data collection approach. So write the next heading, data collection approach. All these things I'm explaining are not in your slides. Data collection approach. Now, the data collection approach, in some textbooks, they will also describe them as designs, but they are not designs. They are data collection approach. Now, the data collection approach, there are three. So we have the quantitative approach. Quantitative approach, that is one. The second one is qualitative approach. Qualitative approach. And the last one is mixed method approach. The first one is quantitative approach. Quantitative approach. The second one is qualitative approach. And the last one is mixed method approach. How many data collection approach do we have?
3.
What are they?
Quantitative
Approach, qualitative approach, mixed method approach.
Good. So I mentioned that in some textbooks, these approaches, they also put them as designs. So in some textbooks, if they say study design, you are going to see descriptive, cross-sectional, retrospective, prospective design. Then they will say quantitative design, qualitative design, mixed method design, but they are not designs. They are data collection approach. Okay. Now let's look at the quantitative approach first. Let's look at the quantitative approach. So I'm going to show you all the characteristics features of quantitative approach. So you can write quantitative approach, you underline, then characteristics features, or the features of quantitative approach. So if someone is using quantitative approach, how are you going to know? If you are using a quantitative approach, it means the data that you are collecting, you are dealing with numbers. Okay, the data that you are collecting, you are dealing with numbers. Okay, so when you are doing a study, Okay, and you are dealing with numbers. So, for example, you are doing a study, you want to know the percentage of students who have suffered from malaria. Okay, you see here, you are looking at percentage, meaning you deal with numbers. So if your group members, you meet and you are doing a study, and let's say you want to know the number of students who have knowledge on something, automatically you should know you deal with numbers. So such a study, the approach you will use is quantitative approach or quantitative data collection approach. Okay, good. So we have quantitative. So if you are going to do quantitative study, then it means that you are going to deal with numbers. Okay, quantitative study. How many approaches do we have?
3.
Yeah, 3. What are they?
Quantitative
Quantitative
approach,
approach,
qualitative
qualitative,
approach, mixed method approach.
Okay. So in quantitative study, how do you know someone is doing quantitative study? That person will be measuring numbers. That's the key thing. So, for example, someone comes to you, the person is doing research, then you ask the person, okay, what are your objectives? The person tell you, oh, I'm looking at the prevalence of malaria among so-to-home residents. Once the person tells you prevalence, the person will be dealing with numbers. Okay, the person tells you, oh, in my study, I'll be looking at the number of students who have knowledge on. Once you hear number, once you are doing any study, you decide to deal with numbers. You are going to do, and in statistics, that's where we call it numerical. Once you are going to deal with numerical data, is that okay? Automatically, you are going to do quantitative studies. Is that okay? So if we ask you what are the characteristics of quantitative studies, if you are going to measure numbers, or you are going to collect data in the form of numbers. So we use quantitative, you do quantitative study when you are going to collect data in the form of numbers. Okay. Now, if you also want to do research and you want to measure patterns, so you can write these things down. You want to measure patterns or you want to measure relationships. So 1, you want to measure prevalence. 2, you want to measure patterns. 3, you want to measure variables in the form of numbers. 1, you want to measure patterns. Patterns means you want to look at the relationship between variables or relationship between patterns. 2, you want to collect data in the form of numbers. Is that okay? Automatically. Or you measure data in the form of numbers. You want to measure patterns. You want to look at relationship between variables. Automatically, you are going to do quantitative studies. You remember hypothesis testing in statistics? You remember hypothesis testing?
Yes,
you know,
please.
hypothesis testing, we use it to look at the relationship between two variables. Now, anytime you want to do a study to look at relationship between two things, automatically quantitative. Okay, so when you want to measure patterns, so when we say pattern, for example, I can say, I want to look at the pattern of malaria between 2020 and 2021. It's quantitative. So when you do want to do a study to understand patterns, you want to, okay, I want to know the pattern of academic performance between, let's say, level 100 students and level 200. Straight, quantitative. So when you want to do a study to measure patterns, you want to do a study to measure relationship, you want to do a study to, and you want to measure your variables in numbers, automatically, you want to do quantitative study. Now, if someone is doing a research and you open the person's work and you see the person is presenting data in the form of frequency tables, please write them down. Someone is doing research, you open the project work and you see frequency tables. Or, for example, your group, your research, your results, you want to present with graphs, pie charts, frequency tables, automatically you are going to do quantitative. That tells that you want to go and do quantitative studies. So when you are going to do a research, and probably you see sometimes you open paper research, sometimes article, you see pie charts, you see frequency tables, you see bar graph. Once you see those things, it means they did a quantitative study. Their approach was a quantitative approach. If it is not quantitative, you won't see pie chart inside. You won't see bar graph and those things inside. So if your group decides that our results, we want to present with graphs, we want to present with pie charts, we want to present with tables, then it means your group, you want to do quantitative studies. Okay, you want to do quantitative studies. Is that okay? Is that okay?
Yeah. So it's that's like the third point, the graph and frequencies. So that's like the third point.
That's
the
the third point.
feature.
So if someone is doing a study, or if you intend to do a research and you want to present your data with graphs, you want to present your data with frequency tables, you want to calculate for percentages, you want to present your data with, let's say, pie charts, then it means you want to do quantitative studies. In qualitative, you can't do those things. Now, the last point I want to talk about is if you want to do a research and you want to design a questionnaire and give the participants options, then you want to do quantitative. You see, sometimes people will bring questionnaire to your class, and the questionnaire you check, you see the questions, they've given you options to take. Have they ever brought things like that to your class, questionnaire like that to your class?
Yes, please.
Then the questionnaire, when you open, when you read, they've given you options you have to take. You don't have to write your idea. Have they ever brought questionnaires like that to your class?
Yes, please.
Yes, please.
Those people automatically means they are doing quantitative study. If they are doing qualitative, they will rather interview you. So they will sit you down somewhere and ask you questions and record. Have they conducted study like that in your class before? That they call some of you and interview you and record?
No.
They've not done that yet. So the ones that they give you questionnaire, and the questionnaire, you see A, B, C, D, then you take the option that is available. They are doing quantitative. So in quantitative, you use questionnaire with close-ended questions, those kind of questions. So you see the questions that they've given you options to choose from. In research, we call them questionnaire with close-ended questions. So when I say questionnaire with close-ended questions, it means that the questions, they've given you questions and they've given you options to choose. You don't have the opportunity to give any option. That's why we say questionnaire with close-ended questions. So if in future your group also decide to do research and you want to use questionnaire that you give them options to choose from, it means you want to do quantitative studies. So in summary, what does it mean? If someone is doing quantitative study, what are you going to see? One, you are going to see the person dealing with numbers. The person will be measuring things in numbers. Two, you are going to see the person trying to measure patterns. Three, you are going to see the person trying to check the relationship between things. They will be checking relationship between variables. Now, four, you are going to see them presenting their information in the form of graphs. So they will present their results in the form of graphs. Okay. Again, you are also going to see them doing descriptive statistics in their research. When we say descriptive statistics, what does it mean? When you are calculating for percentages, when you are calculating for mean, when you are calculating for mode, when you are calculating for standard deviation, variance. So you take someone's research work, you see the person is calculating so Okay, or did they collect data in numbers? For example, you are doing research, you are checking people, you are checking patient BP, you are dealing with numbers. You are doing research, you are counting the number of people who have knowledge about something. Once you are counting numbers, you are doing quantitative. When you are measuring any data in the form of numbers, so if you meet in your group and you start your project, ask yourself, will you measure anything in the form of number? Once you measure anything in the form of number, it means the approach you are going to use is what? Quantitative. Okay, the next thing is that, do you want to present your results with pie charts? Do you want to present your results with graphs? Do you want to present your results with line graph? Do you want to present your result with frequency distribution table? If you decide to do that, you are doing quantitative approach. You are using quantitative. It means the approach you want to use is quantitative. Is that so? The questions you have to ask yourself, okay, do you intend to present your information with graphs? Do you intend to present with frequency tables? Okay. So once you intend to present with frequency tables, it means you are using what? Quantitative approach. Is that okay? Great. So once you decide that this research, we want to present with frequency tables, it means you are going to use quantitative. Okay, if you are going to do research and you want to do descriptive statistics, like you want to calculate for mean, you want to calculate for percentages, you want to calculate for standard deviation, you want to calculate for variance, you want to do hypothesis testing, what type of approach will you think of?
Quantitative.
Yes, quantitative. Quantitative. But remember, it can also be mixed method. I'll come to mixed method. Mixed method is a combination of both quantitative and qualitative. We've not done qualitative yet. When we finish qualitative, you now understand mixed method. Okay, so if you take someone's research work and you see the person is having graph, pie charts, the person is having graph, pie charts, the person is calculating for percentages, the person is calculating for mean, the person is calculating for standard deviation. You see all that. The person is using questionnaire with close-ended questions. Automatically, you know this is a quantitative studies. Nobody should tell you. You shouldn't ask the person. It's quantitative. Is that okay? So if people bring questionnaire to your class, you see the questionnaire, all the questions, they've given you answers. It means they are doing quantitative studies. That's the meaning. Okay, good. So now you know the characteristics of quantitative approach. What are the characteristics of quantitative approach? Yes, what are the characteristics of quantitative approach?
It deals with numbers.
Deal with numbers.
It deals with numbers. That's the first
And
thing.
then,
What's the second thing?
Patterns.
You want to measure patterns. The next?
And then you measure relationships.
You want to measure relationships. That is also correct. And then
the use of graphs and frequencies.
You want to present your results with graphs. You want to present your results with frequency tables. You want to do hypothesis testing. You want to calculate standard deviation. Then it means you want to use quantitative approach. Any other?
So you said questionnaires where you use close-ended questions.
Good. That's the major point. That is one key point. If you want to do a research, you want to use only questionnaire with close-ended questions. So listen, you see here I'm using only questionnaire. Look at the keyword I'm using. So you want to do a research. You want to use only questionnaire with close-ended questions. So look at how I'm qualifying it, because mixed method is different. Mixed method, you can use both questionnaire with close-ended questions and interview guide. But for quantitative study, you use only questionnaire with close-ended questions. Is that okay? Okay, so now let's move on to qualitative. So now that you know quantitative, let's move on to qualitative studies. So you can write qualitative study design and then underline. And let's look at qualitative studies. Yeah, okay. Can we start? Can we go on?
Yes, please.
Good. So for qualitative studies, anytime you want to do a study to understand the experiences of people, anytime you want to do a study to understand the experiences of people, 2, you want to do a study to measure and understand the behavior of people. 1, anytime you want to do a study to understand the experiences of people, anytime you want to do a study to understand the behavior of people, then you want to do a qualitative study. Or you want to do a study, but you don't intend to measure numbers. So look at the definition. Anytime you want to do a study to understand, 1, the experiences of people, that is 1. You want to do a study to measure the behavior of people, that is 2. You want to do a study, but you don't want to collect data in numbers, then it means you want to do qualitative study. So when your group members meet and you say, okay, you said your research, you don't want to measure anything in numbers. You don't want to collect any information in numbers. Then it means you want to do qualitative studies. For example, we have students that do research. They don't measure anything in numbers. Then it means they are doing qualitative studies. Now again, if you want to do qualitative study, you will not present your data in frequency distribution tables. You will not present your data with pie charts. You will not present your data with bar graph. Let me take it again. Anytime you want to do research to measure the experiences of people. So if I ask you, someone wants to do research to measure experiences of nurses on teenage pregnancy, what design is best? Qualitative. Keep it in your mind, qualitative. So anytime your research, one of your objectives, you want to measure experiences, the best design to use is qualitative. Once you decide in your mind that you want to measure experiences, the best design to use is qualitative. Now, even if you want to measure, you want to understand human behavior, the best design to use is qualitative. Human behavior. The best design to use is what? Qualitative. Now, and I also mentioned that if you want to do research, you see in quantitative, how do we present results in quantitative? Yes, how do we present results in quantitative?
With numbers.
With numbers?
With
You measure the
patterns.
patterns.
With patterns? No, I mean, how do we
Relationships.
present the results? How do we present the
It
results?
should be in a questionnaire.
Questionnaire.
No, not collecting data. How do we present the results in
Yeah, with
quantitative?
in a graph form.
Good. Either in a frequency distribution table, in a bar graph, in a pie chart. Now, if you want to do research, but you don't want us to see pie charts. Let's say your group members, you say your research, you don't want anything pie chart, you don't want frequency table, you don't want bar graph. Is that okay? Then you want to do qualitative.
So it's the opposite of the quantitative.
It's more like the opposite. So if someone tells you he or she did a qualitative study, when you take the person's work, don't expect to see tables, don't expect to see pie charts, don't expect to see bar graph, don't expect to see bar graph, pie charts, don't expect to see any tables and graphs in the person's work. Okay, so they will be, so if you want to see someone conducted qualitative, what you are going to see is you see someone, it's like the person is writing an essay. So it's like two people are doing an interview and the person is writing an essay of the interview. It's like narration of their interview. Then it means the person conducted what? Qualitative studies. So in qualitative studies, you won't see bar charts, you won't see pie charts, you won't see bar graph, you won't see tables, but you see what we call narrative description. Narrative description. Okay, narrative description of an interview between two people. Narrative description of an interview between two people. So when we ask you, how do we present results in qualitative study? What are you going to say?
Narrative description
Of an interview between two people. Okay, so narrative. So if someone do qualitative study, you take the person's project work. Don't expect to see pie charts. Don't expect to see bar graph. Don't expect to see frequency tables. You rather see narrative descriptions of the interview between the two. That is what you will see in the person's work. Narrative descriptions of the interview between the two, between two people. Is that okay? Great. So what is qualitative approach? Yes, what is qualitative approach?
So it's an approach that you use narrative description to interview two people.
Okay.
Or narrative description of an interview between two people.
Okay. So you can say for someone to use qualitative approach, what it means is that they will not present data with graphs. They will not present data with pie charts. They will not present data with frequency tables, but then they will present data in the form of a narrative description between two people. So when we ask you what is qualitative approach, a qualitative approach is an approach where someone intends to do research, will not measure any data in numbers. That's the first thing you have to say. You not measure anything in numbers. So in statistics, that's what we call non-numerical data. Non-numerical. And we did that. Non-numerical data. Meaning you not collect any data in the form of what? Numbers. That is one. Two, you not present any information in the form of pie charts, in the form of tables, in the form of what? Graphs. Three, you would only present your results in the form of what? Narrative description. More like a narrative description of the interview between two people. Is that okay? So what is qualitative study? When we say qualitative approach, what does it mean?
It's an approach that the researcher do not measure anything in form of numbers.
Good, excellent. Yes. Any other? Any other?
Researcher do not present the research in line graph or a pie chart.
Good.
But
you will not see a line graph in the researcher's work. You will not see pie charts. Okay, continue.
But uses a narrative description.
Good. A narrative description. Yes. So if you open someone's work and the person did qualitative, when you go to the results section, you are not going to see a pie chart. You are not going to see line graph. You are not going to see the person presenting the results or the data with line graph, pie chart, but you are going to see something like an essay. It's like someone is describing interview between two people. Once you see something like that, it means the person used what we call qualitative study, or the person conducted what we call qualitative study. Is that okay? Yes, please.
Please, I made my own definition, but then I wanted to ask if it could be acceptable.
Okay, go ahead. I'm listening, please.
Qualitative study. This study makes use of narrative description of an interview between two people.
Good.
Presents data about the use of numbers, patterns, frequency, distribution,
good,
pie or bar charts, line graphs, etc.
Good. It's correct. So the only thing you left out is that we use qualitative to measure experiences. It's a major point. So if you want to do research to measure people's experience, so if I ask you, someone wants to do research to understand the experiences of nurses, which approach is the best? Qualitative approach. That's the best. Okay, you want to do research to collect data, but you don't want to collect numerical data. You want to collect non-numerical information. Which approach is the best? Qualitative. Is that okay? Again, you want to do research. You don't want to present your results with graphs, tables, pie charts, line graph, the best design you want to use is qualitative. Is that okay? So that is basically what qualitative approach means. Now, which instrument will you use in qualitative studies? Yes. Okay, which instrument do we use in quantitative? Which data collection instrument do we use in quantitative?
So is it the graph? Or
Which data collection instrument do we use in
questionnaire?
No, it's not questionnaire. Remember, be specific. You have an idea, but it's not questionnaire. Be specific. We didn't say questionnaire. Be specific.
Close-ended.
No. So
Graph.
come again. No, frame it again.
Close-ended questions in only questionnaires.
No, frame the sentence well. It's questionnaire. Someone has
Only
added a close-ended.
questionnaires
So use
with
this.
close-ended questions.
Good. So questionnaire with close-ended questions. Questionnaire with close-ended questions. What does that mean? When we say questionnaire with
Is
close-ended,
that for quantitative?
that is for quantitative. Quantitative. Questionnaire with close-ended questions.
Okay, thank you.
Close-ended questions. When we say questionnaire with close-ended questions, what does it mean? Yes, what does it mean?
So it means the researcher will give you option to choose from.
Good. We will set the question and give you options to choose. You will not write your option. So when we say questionnaire with close-ended question, it means I will set my question, then I will be the one to give you option you choose. You, the participant, will choose. You will not write your own answer. That kind of questionnaire is what we call questionnaire with close-ended questions. Okay, qualitative. If someone is doing qualitative, what instrument will the person use? You know, for quantitative. For qualitative, what instrument will the person use?
Narrative description of an
No.
interview. That's
Is it the interview?
We are talking about the instrument.
So,
That
questionnaire
is the
with
interview.
open-ended questions.
Again?
So, questionnaires
Yes.
with open-ended questions.
We call it interview guide. There we don't call it questionnaire. We call it interview
Questionnaires
guide.
with open-ended questions.
No. We call it interview guide with open-ended questions.
No, you didn't state that.
Is that okay? Oh, that one I didn't mention, but at least
you
someone has been
didn't.
able to say the correct thing. Yes. So we call it interview guide with open-ended questions. So that one, you are going to see the person will ask questions. Let me see whether I have some here. So the person will ask questions, and then they will put question mark there for you to answer. So look at it. This is what we call interview guide. Look at how it looks like. You see, can you see any options there for you to choose? Look at. You see the question, can you describe your experiences as a palliative and oncology healthcare provider caring for patients with cancer? You see this one? Can you see any options under the question for the respondents to choose?
No.
No options are there. So automatically, if you open someone's work, you see questions like this. Don't ask the person whether you did qualitative or automatically it's qualitative. And this is what we call interview guide. This one is not questionnaire. It's an interview guide. Yes, there are some people call it, it's not a questionnaire. In qualitative, you use interview guide with open-ended questions. Why do we call it open-ended questions? Yes, who have an idea? Why do we call it open-ended questions?
It's open-ended because when the question is asked, the respondent is supposed to answer, like the interview.
You have to answer in your own words.
Yes.
Okay, and what's the meaning of close-ended?
Close-ended, the options have been given. It's either you choose a true or false or yes or no.
Good. You don't have the opportunity to give any answer outside of the options given. So we say close-ended. But that one, you not say, we call it questionnaire with close-ended questions. But when they interview the qualitative, you don't say questionnaire with open-ended. We call it interview guide with open-ended questions. Okay, but if you go somewhere, you go and see someone saying questionnaire with open, it's wrong. It's interview guide with what? Open-ended questions. Is that so? In qualitative studies, we use what? Interview guide with open-ended questions. Quantitative study, what instrument do they use? They use questionnaire with close-ended questions. Is that okay? So if they ask you with quantitative studies, what instrument do they use? They use questionnaire with close-ended questions. Qualitative study, what instrument would they use? They use interview guide with open-ended questions. What's the meaning of open-ended questions? Meaning you ask them questions and give them the opportunity to answer with their own expressions. Why do we say close-ended questions? You ask them questions, you give them options to choose from. Is that okay? Please, are we together?
Yes.
Okay.
Yes.
Now, let me ask you this question. Differentiate between quantitative study and qualitative study. Differentiate between quantitative study and qualitative studies.
With quantitative study, we use questionnaires with close-ended questions, whilst
Okay.
with qualitative, we use interview guide with open-ended questions.
That is one.
In quantitative approach, we deal with numerals.
We
And
deal with
qualitative
numbers.
approach, numbers, yes, numerals. And with qualitative study approach, we deal with understanding the experiences of people or their behaviors.
Good. That is fine. That is fine. Again, in qualitative, we do not deal with numbers, non-numerical data. You don't deal with numbers. Okay, any other? You've mentioned 2 so far. You've given 2 differences so far.
So with quantitative, we use descriptive.
You can use descriptive statistics. Okay.
Yes, whilst with qualitative, we use narrative.
Yes, so you can't, don't go and write it and leave it at descriptive. Just say that in quantitative, you can do descriptive statistics. Because if you say descriptive alone too can be for qualitative. Descriptive is about describing. So you say we use descriptive statistics.
Okay.
So if someone is doing research, the person is calculating for mean, standard deviation, variance, hypothesis, the person is doing quantitative. But in qualitative, what do? We use narrative description of interviews between 2 people. Any other?
So with quantitative approach, the work is in the form of a bar graph, pie chart.
Good. The results can be presented in the form of bar graph, frequency tables, pie charts. How about in qualitative?
They do not present their work in pie charts, no line graphs, and then frequency tables.
So how do they present their results? Yes, how do they present their results? If someone is doing qualitative study, how would the person present the results?
It's using narrative description of an interview between 2 people.
Good. Narrative description of an interview, and study design will come in the exam. So there is no way you write research methods. You won't have a question on study design. That's the major area, because all the research you are going to do, everything depends on research design. Is that okay? Great. So what are the characteristics of qualitative study? Mention all the characteristics of qualitative study. If someone do qualitative study, you take the person. What are all the things you're expecting to see?
To understand the experience of people.
We use it to understand the experience of people. That is one. Not only that,
and to understand the behavior of people.
We use it to measure the behavior.
To understand the behavior.
That is correct. Any other?
And you don't use numerical data.
You do not measure numerical data. That is correct.
And we use an interview guide with open-ended questions.
An interview guide with open-ended questions. That is correct.
And the narrative description of an interview between 2 people.
Narrative description of an interview between 2 people. Any other?
We do not use graph frequency tables.
We do not use graphs. We do not use frequency tables. We do not use pie charts. We do not do any statistical calculations. That is correct. Any other?
It can also be called non-numerical.
Okay, so you deal with non-numerical data. That is also correct. Any other? I think so far you've mentioned all. That is great. How about quantitative study?
Quantitative deals with numbers or prevalence.
When you want to measure information in numbers, for example,
Yes.
you want to measure prevalence, you want to measure number of people with knowledge on something, you want to measure anything in numbers, quantitative. Any other?
Use patterns.
You want to measure and understand patterns. Any other?
We present it in graph frequency distribution tables.
You want to present your results in graphs, in frequency distribution. Any other?
We use to measure relationships.
You want to measure relationship between two things. That is good. Any other?
Only use questionnaires with close-ended questions.
You only use questionnaires with close-ended questions. And that's the instrument. So you say in quantitative, the instrument we use is what? Questionnaire with close-ended questions. So now, put the two together and give me the definition of MESS methods. MESS method use both. So put the two together and give me the definition of MESS method study.
MESS method approach is the use of both quantitative and qualitative.
That is great. Approach. That's the first thing you have to say. So in MESS method, you are going to use both qualitative and quantitative study approach. So with that, what are you expecting to see?
Where we use both the close-ended questions and open-ended questions.
Don't say it like that. Repeat it again. All the time, say questionnaire with...
Questionnaire with close-ended questions.
Good. Questionnaire with close-ended questions. Don't write it close-ended questions. So it's not accepted. So questionnaire with close-ended
questions. And then an interview guide with open-ended questions.
Excellent. What other thing do you expect to see in MESS method? It's a combination. So now you are combining the two. So if someone do MESS method, what you mentioned in quantitative, what you mentioned in qualitative, all comes in MESS method.
We use both descriptive statistics and narrative description of an interview between two or more people.
Okay. Okay, that is good. Any other? There is more. There are more. So you are going to see both descriptive. You are going to see the person presenting the data with graphs, with pie chart, frequency table, calculating percent. And again, you are also the same work. You are also going to see the person describing a narrative description of interview between two people. Any other information in MESS method? Yes. Any other thing in MESS method? Yes. Any other thing in MESS method? Okay, so say the MESS method again. Another person should also say the MESS method again. Yes. Let's have another person to say the MESS method again. Yes.
The mixed method approach is a type of approach which includes both the qualitative approach and the quantitative approach.
Excellent.
It also deals with numbers, and it also deals with understanding the experiences of people.
Good. Excellent.
And with the mixed method, descriptive statistics and narrative description between two people in an interview form can also be used.
Yes. Yes.
Questionnaires and close-ended questions, and also interview guide with open-ended questions can also be used in the mixed method approach.
Good. Yes, they are used. They are used. So they are actually used. So a MEST method, questionnaire with closed-ended questions, and interview guide with open-ended questions are used in MEST method approach. Okay, any other points? Any other points? Okay, so basically that is it for MEST method. So we can ask you to write short notes. Okay, so if we ask you, can ask you to write short notes on the 3 common study designs: retrospective study design, cross-sectional, descriptive cross-sectional design, and prospective study design. How will you answer that? Write short notes on the 3 common designs: retrospective study design, cross-sectional design, and prospective study design. How will you answer that?
So with the descriptive study design is where
descriptive cross-sectional,
descriptive cross-sectional design. Sorry,
okay.
we conduct a study at a single point in time or a snapshot.
In time,
and
okay.
With retro is where we review the past records. That is records that are already in existence.
Good, excellent.
And with the prospective is where you do a research or study ahead of time.
Okay.
So I said the 3.
Oh, but at least they said describe. So at least talk about some of the disadvantages.
Oh, okay. So
yes, with take any of them. So with retrospective, tell them about some of the disadvantages. And tell them about.
With the retrospective, we have incomplete data.
Data.
You are compelled to use like selecting bias and information.
There can be data selection bias.
Yes, please.
Data selection bias, meaning you'll be compelled to just use what is there, select from what is there. Okay, that's the data selection bias. Any other?
And with the prospective, with the advantages, it helps to reduce recall bias. It gives you detailed information, and you have a complete data. But you can have a disadvantage where you have lots to follow up.
Okay.
And then you have a long timeline.
Okay. Any advantage? Can you mention any advantage for retrospective study designs? Advantages. Retrospective study designs, advantages. Can you think of any advantage for retrospective study designs?
The data is already collected.
Good. So it's time efficient. You don't waste the retrospective. In fact, it's also resource efficient. You don't spend a lot of money. The data have already been collected already. You are not going to do any data collection. You are just going to review existing data. Is that okay? So it saves time. The second point is that it saves you a lot of resources because the data is already there. That's one advantage of the retrospective. It saves time. Okay, good. And then the data is already in existence. So you don't have to spend a lot of resources. Okay, just that the disadvantage is that the data may be incomplete. The data may lack things that you want. So you may be forced to select from what is there. And that's where the selection bias comes in. Again, because you are collecting data into people's past, some of them may forget, especially when you are collecting the information from the people. They may forget. So one disadvantage is also recall bias. Is that okay? Okay, now talk about the cross-sectional design. Descriptive cross-sectional design. Yes, talk about descriptive cross-sectional design.
So it's a data collection done at a single point in time.
So the data collection is done at a single point in time. At a point in time. And that's why we use the snapshot in time. Some books, they'll say bird sky view. You see when the bird is in the sky, they see everything on the ground at once, at a glance. So in some textbooks, you see bird sky view. That's the meaning. It means when you are a bird, you are in the sky and you look on the ground, you see everything at a glance. Is that okay? Yes. So in some texts, we are going to see them using the word bird sky view. That's the meaning. Okay. Yes. Continue, please.
It's done in the present, not past or.
Good. It's conducted in the present. Yes, in the present. So meaning now. So that study, you are not going to do it into the future. You are not going to do review past record. You are doing it now in the present. So the timeline is what? Present. Any other? What are some of the advantages of cross-sectional? Data completeness. The data, you have the opportunity to complete the data because you are collecting, and it will also minimize selection bias because cross-sectional you are collecting. So what you want, you put it in your questionnaire and collect. Is that okay? Unlike retrospective that the data is already there that you are going to review. So if what you want is not there, you have to just select from what is there. But cross-sectional, you are doing it now. So whatever you need, you can take it. So it can also minimize selection bias. Okay, good. Prospective. Yes, prospective study design. Talk about prospective study design.
Yeah, please. You said it's a data collection done ahead of time or into the future.
Data collection done ahead of time into the future. Okay, good. So we use the word forward in time, ahead of time, forward into the future. Okay, so the timeline for prospective study is forward into the future. The timeline for cross-sectional is present now. The timeline for retrospective is backwards in time. Is that okay? Okay. Any other characteristics of cross-sectional? Any other characteristics? Sorry, any other characteristics of the prospective?
You gave a timeline. You said the duration 2 to 10 years.
Yes, so it can be done. So the forward in time, meaning you are doing a study to extend, let's say 2 years, 3 years, 4 years, 5 years, 10 years or more, all comes under prospective studies. Any other?
So you spoke about the advantages.
Good. What are the advantages?
You said it gives us time to gather detailed information. Or
good. You have more time to gather detailed information. You have more time to gather accurate information. Any other?
It reduces recall bias.
Good. It reduces recall biases or minimizes recall bias. How about selection bias?
Yes, it also minimizes it.
Good. It also minimizes selection bias. Any other?
And ensures completeness of data.
Good. You have the opportunity to get a complete data. Okay. How about disadvantages?
You said loss to follow up.
Loss to follow up may be there.
You explained that sometimes the researcher may die. The people would like to back.
The researcher may give up and stop the work. Some of the participants can die and be out of the. Some participants may even become seriously ill. You can't use a seriously ill person as a study participant. Some of the participants may even decide that I won't continue with the study again. Okay, loss, and in research, that's what we call loss to follow up. It's one of the limitations of what prospective studies. It's one of the dangers. At a point, maybe you get to mid-study period. Let's say, the middle of the study, someone will say, "Oh, me this study, I'm tired. Please take my name off. I'm not part again." Someone may travel. You call the person, say, "Oh, I traveled. I'm no more around." Loss to follow up. It's one of the disadvantages of prospective studies. Any other?
So you said this.
Yes.
So you said that's a long timeline.
It's time consuming.
Good. It's time consuming. It's time consuming. It's time consuming. Okay. It's time consuming. Okay. Good. So that is the difference between. So basically now you know the 3 common study designs. So the 3 common
constraints or high cost.
Designs. Good. It involves a lot of resources. You have to use a lot of resources. So please, you have to know the 3 study designs. So retrospective study design, the advantage, disadvantage, prospective study design, advantage, disadvantage, and their meaning. Descriptive cross-sectional design, advantage, disadvantage, and the meaning. You should know. Is that okay? Great. And then the study approach. I told you in some books, you see them calling it design. It's not design. It's data collection approach. So the approaches, we have three. The quantitative approach, qualitative approach, and mixed method approach. Is that okay? Qualitative approach, quantitative approach, and mixed method approach. Is that okay? So know all the approaches and know all the design. So now let's look at, so now that you understand the design and approach, let's see how in research, the research design. Remember, I keep telling you that the theory part is different from the paperwork. The theory part is about you understanding. So now you understand. But when it comes to how we describe design, we have a format we follow. Okay, so let me take you through quickly the format that you use when you are writing your design. So you can write how to write research design in proposal or actual project work. How to describe research design in proposal or actual project work. How to describe your research design in proposal or actual project work. How to describe research design in proposal or actual project work. How to describe research design in proposal or actual project work. Have you gotten it?
Yes, sir.
Okay, that's fine. So let's look. First of all, when they ask you, when you get to, and that is the chapter, that is chapter 3.2. You see, this is how the chapter 3 look like on the heading. So let's see your guideline. This is how your guideline look like. You see the guideline. You see we have chapter 3, research methodology. 3.1, introduction. 3.2, research design. And that is what we have over here. So you see 3.2, research design. Now, the first thing, so remember, when you are writing research design, you can write it in, let's say, you can say 120 to 150 words. So the word count, you can write 120 to 150 words. 120 to 150 words. 120, it's one paragraph, 120 to 150 words. And we don't bullet. You don't have to bullet. So 120 to 150 words. 120 to 150 words. And you don't have to bullet. 120 to 150 words. 120 to 150 words. Now, the first sentence, you write the definition. You define research design. So you see here, you see, they've given a definition. You can pick the definition from the slide. You can also pick the definition from a textbook in the library. You can pick the definition from a good source online. It depends on your group or you, the person who is doing the research. So you see, the first sentence, you see, they are defining research design. Research design refers to the overall plan or blueprint that guides how a study is conducted, including the methods for collecting, analyzing, and interpreting data in order to answer research questions. So you see, the first sentence is a definition. So your first sentence, you define what research design means. Is that okay? Now, the next sentence, you are going to tell us the design you will use. And remember, when you get over here, the design is 2 designs that you can use at your level. Either you are going to use descriptive cross-sectional design. So listen carefully. Those of you who do qualitative studies, those of you who want to do interviews, the design you are going to use exploratory design. Please write it somewhere. You see that one, I didn't mention it. That one is not part of the common designs, but when you are writing, it's there. So for those of you who use qualitative, who will be doing qualitative study, you will do exploratory research design. Exploratory research design. And for those of you who will be doing quantitative study, those of you who want to present your data with graphs, pie charts, you are going to use this design. a descriptive cross-sectional design. Okay, so this is how you write it. The study would adapt a descriptive cross-sectional design using quantitative approach to data collection. So you see the sentence, look, learn how to construct it too, and you always have to construct it this way. You can't construct it in any other way. So you go like this. The study would adapt descriptive cross-sectional design using quantitative approach to data collection. You see how the sentence has been constructed. So for those of you who will be doing quantitative studies, this is how you are going to write it. The study would employ descriptive cross-sectional design using quantitative approach to data collection. Now, for those of you who do qualitative, when you get over here, the second sentence, you write, this study would employ exploratory research design using qualitative approach to data collection. So the first sentence, you define research design. The second sentence, you are going to tell us the design you use. If you are going to do quantitative study, this is how you construct your sentence. This study would employ or would adapt descriptive cross-sectional design using quantitative approach to data collection. You see how it goes. And all the time, this is how you construct the sentence. So the moment you decide to do quantitative study, when you get here, the second sentence, this is what you write. This study would employ descriptive cross-sectional design using quantitative approach to data collection. What if you are going to do qualitative studies? How will you construct the sentence?
This study will adopt exploratory research design.
Good. Using
qualitative approach
to data collection. Good. That's how we construct it. Okay, so those of you who will be doing quantitative study, your second sentence, you write, the study would employ descriptive cross-sectional design using quantitative approach to data collection. Those of you who will be doing qualitative study, those who want to do interviews, those who want to use interview guide and do interviews and record, you write, the study would adapt exploratory research design using qualitative approach to data collection. Exploratory research design is the same as qualitative studies. It's the same thing, just that the sentence, this is how we want you to construct it. So when you say, if you are going to use interview guide, you write, this study would adapt exploratory research design using qualitative approach to data collection. Now, when you finish your next sentence, you will now define what descriptive cross-sectional design means. Then you give us one advantage. Then the next sentence, you define what quantitative approach to data collection means. That is what you've done. You already know the definition of quantitative. You use it to measure numerical numbers when you want to capture information in numbers. Okay? For example, you want to measure prevalence. Or you want to present your data in graphs. You want to present your data in pie charts. You want to deal with questionnaire with close-ended questions. That's the meaning of quantitative approach. So your next sentence, after telling them that this study would adapt descriptive cross-sectional design using quantitative approach to data collection, you now define what cross-sectional study means. And you know cross-sectional is conducted at a single point in time. You define it. Then you give us one advantage of it. Then the next thing, you now define what quantitative approach to data collection is. Then at the end, you tell us the reason why your study, you decided to use descriptive cross-sectional design and quantitative approach to data collection. So I said the first sentence, you define research design. The second sentence, you decide, are you going to use qualitative or quantitative? If you are going to do quantitative, you go like, this study would adapt descriptive cross-sectional design using quantitative approach to data collection. This study would adapt descriptive cross-sectional design using quantitative approach to data collection. But if you are going to use interview guide, if you are going to do qualitative, you say this study would adapt exploratory research design using qualitative approach to data collection. Then your next sentence, you define what cross-sectional design is. Okay, if it was a qualitative study, this sentence, the next sentence after you telling them what you adapt, what will you do? You define what exploratory research design means before you now tell them an advantage. Then the next, you define what qualitative approach to data collection means. Then when you finish, in summary, you tell them the reason why you're studying. You've decided to use descriptive cross-sectional and then the quantitative approach. If it is qualitative, you tell them the reason why you're studying. You've decided to use explanatory research design and qualitative approach. So for the last time, you first of all have to define what research design means. Then you tell them why you you tell them which of the designs that you've adapted. So if you are you want to do quantitative study, this is how you construct your sentence. This study would adapt descriptive cross-sectional design using quantitative approach to data collection. If you want to do qualitative study, that one you say this study would adapt exploratory research design using what? Qualitative approach to data collection. When you finish, you define what the descriptive cross-sectional design means and give one advantage. Then you also define what quantitative approach to data collection means and give an advantage. When you finish, you now come and tell them the reason why you're studying. That's the last thing you do. The reason why you're studying, you think the descriptive cross-sectional design and quantitative approach to data collection is suitable for your study. That's the last thing you do. You tell them why the design and the approach that you've chosen is suitable. Is that okay? Okay, who can describe? How do we describe research design in project works and proposals?
So,
yes.
So the word count is 120 to 150 words.
Okay, that is fine.
And you do not bullet. So the
you do not
first
bullet?
step is you defined the research design.
Okay.
Then you tell the design that you use. Either you use a descriptive cross-sectional design, which is a quantitative, or the exploratory research design, which is a qualitative.
Okay,
then,
that is great.
Then you define the design that you use. For example, if you
okay, so let's assume you want to do quantitative study. How will you write the second sentence? In a proposal, if you want to use a qualitative, you want to do quantitative study, quantitative, how will you write the second sentence?
So you still like, okay, this study will adopt a descriptive cross-sectional design using the quantitative approach to data collection.
Okay, how about if you want to do qualitative study, how will you write the second sentence?
This study will adopt an exploratory research design using a qualitative approach to data collection.
Okay, that is fine. Okay, how about if you want to do MESS method? Nobody asks. What if you want to do MESS method? How will you write the second sentence? That one, you use the descriptive cross-sectional. So if you want to use, you say this study would adapt. The moment you decide to do MESS method, it means quantitative approach and qualitative approach. So that one, you say this study would adapt descriptive cross-sectional design using MESS method approach to data collection. So keep it in your mind. When you decide to do both quantitative and qualitative, you use the descriptive cross-sectional study. So you say this study would adapt descriptive cross-sectional study design using MESS method approach to data collection. Is that okay?
Yes.
All right, that is fine.
So then
that is fine.
go ahead and define the
Then the
design
next
you use. For
sentence,
example, if you use the descriptive, you
cross-sectional.
define what the
Okay.
descriptive cross-sectional is, and then you give
Okay.
one advantage.
Okay.
Then you define the approach that you use.
Okay.
For example, what the quantitative is.
Okay. So
Then the
if you
last
use
one,
quantitative, you define and give an advantage. You
yes,
always
please.
define and give an advantage. Okay. Then the last thing you
And
do,
then the last one, the reason why you used the design
the
and the approach for
design
the
and the
study.
approach. Excellent. The reason why you use the design and the approach. Excellent. That's the last thing you do when you are describing. Okay. What if someone want to do retrospective study design for the research? How will the person write the research design? If you decide to do retrospective studies, how will you go? Who can try? If you decide to do retrospective study, how will you write the research design? Yes. Who wants to try?
So please come again.
If someone decides to do retrospective study, retrospective is not cross-sectional. So let's say your group, you've decided to do retrospective study. How will you write the research design section? Yes, how will you write it? Yes, who wants to try? Yes, who wants to try? It's the same format. It's the same format.
Sir,
Yes.
please, I'm trying now.
Okay, go ahead.
This study will adapt.
No, start from the first sentence. The first sentence, what are you supposed to do? Yes, the first sentence, what are you supposed to do? The first sentence, what are you supposed to do? Just like the first one. It won't change. Just like the first.
Explain what.
Yes.
You explain what a research design is.
Yes, the first sentence. Here too, you have to define what research design is. Yes. Before you move on to the second sentence. So the second sentence.
Yeah, this study will adapt the retrospective study design using a qualitative approach to data collection.
Retrospective, you use quantitative.
Quantitative,
yes.
Yeah, quantitative.
Yes, you surely collect in numbers, so you use quantitative.
Yeah, collect in numbers.
So that's the trick. So the trick is that retrospective, you collect in numbers. So this study would adapt descriptive cross-sectional design. Retrospective study design using quantitative
approach to
data collection. Then now you come and define
explain the retrospective
and give an advantage.
You
get it? Yes. Then you now define the quantitative approach and give give the advantage. Then now you tell us the reason why your study
you chose that design.
Retrospective design and quantitative approach is suitable. Then you are done. The same thing. The same thing. How about prospective study? Let's say your group, you decide you want to do the study 5 years. How will you write the research design?
So you explain the research design.
You define, that is fine.
Yeah. Then you come and talk about the perspective.
Come again. We didn't hear you. I think your line, your network.
Adaptive. The perspective.
Yeah. Perspective study design.
Firstly, you explain the research design.
Good. Yes. That is fine.
Then secondly, you come and adapt to the the perspective study design. So here, I don't know if you use qualitative. because since it's
No,
taking
you
it,
use
not much time.
quantitative. So this
You
study would adapt
still use quantitative.
prospective study
So the
design
quantitative design
using quantitative
using a
approach to data
quantitative
collection.
approach.
To data collection.
Yes, they come
Is
and
that okay?
explain the
Prospective
yes
study design. Then,
design.
but commonly at your level,
Mm-hmm.
most groups or most students, they use the descriptive cross-sectional or the
Descriptive or
exploratory,
retrospective.
or most of the students. It's just a few students that I know they are doing retrospective. But majority of the students, they use the descriptive cross-sectional using quantitative approach. Majority of the students who are using exploratory research design using what? Qualitative approach to data collection. So you see, it's one thing understanding the approach, the design. So you see now you know the designs and you know, but you see when you are writing the research design section, it's like you combine a design and an approach. Have you seen that? Have you seen that when you are writing the description of the design section, it's like a combination of a design and an approach. So you combine descriptive cross-sectional with the quantitative approach. Is that okay? So that means descriptive cross-sectional, meaning the study you do it now. In addition to that, you are going to be dealing with numbers. And again, you are going to be presenting your data with what? So you see, this person's study, if you go, you are going to see graphs and tables. So you see, if you go and check the person's results, you surely go and meet graphs and tables somewhere in the work, provided the person have done the chapter 4 and 5. This person have not done the chapter 4 and 5. Is that okay? So basically, that is it. So that is it about the research designs. Okay, mostly in research exams, you get a lot of questions on the research designs. Is that so? Know the 3 common designs. So the 3 common designs, we have the cross-sectional design or descriptive cross-sectional design. We have the prospective design or prospective study design, and we have the retrospective study design. Know the advantages and disadvantages. We can ask you to differentiate between the 3 common research designs. So prospective study design, retrospective study design, descriptive cross-sectional design, differentiate between them, stating the advantages and disadvantages. Okay, again, the data collection approach. How many data collection approach have we discussed today? Yes, how many data collection approach have we discussed today?
3.
3. What are they?
Quantitative approach,
Quantitative approach. Quantitative
and
approach.
mixed method approach.
So quantitative approach, quantitative approach, qualitative approach, and mixed method approach. Is that okay? Yes, you should be able to distinguish between the 3. Quantitative approach, what does it mean? When do we use it? Which instrument do we use? Qualitative approach, what does it mean? You should be able to differentiate between the 3 clearly. Can ask you to write short notes on quantitative study approach, qualitative study approach, and mixed method study approach. We can ask you to write short notes indicating some of the advantages and disadvantages. Is that okay? So practically, we've discussed one of the very important parts of the chapter 3. So like I mentioned, you should know everything that the chapter 3 covers. So the chapter 3 covers introduction. If I ask you, okay, write all the areas that a researcher have to cover in the chapter 3 section or the methodology section of the research work. Research study design or research design, study area, study sample, sampling size determination or sample size determination, study variables, sampling procedure or technique, data collection instruments or tools, data collection procedure, data analysis, validity and reliability, ethical considerations. Okay, so I think have we done study area? We've done study area, right?
Yes, sir.
We've done study sample, right?
Yes, sir.
Have we done, which other one have we looked at? Have I done sampling procedure with you? The other class we've done, so in fact, the other class we finished everything research methodology. Have I done the sampling procedure with you? Have we gone through the sampling procedure?
So is it the one you said sampling techniques?
Yes, the sampling technique where we have the convenience sampling, the non-probability sampling,
Yes,
the probability
we've done
sampling.
that. And the
Have we done that?
Yes.
Probability
Yes, the
sampling.
purposive,
Under
the
probability,
snowball.
we have the quota sampling. Under the probability sampling, we have the simple random sampling,
Simple
stratified
random.
sampling,
Snowball.
Yes.
cluster sampling. No,
Sampling.
snowball is for the
It's
other
under
one.
non-probability. Purposive
Non-probability.
Yes. So we've
So
done it.
we did simple random sampling, systematic sampling,
Yes.
stratified sampling,
Yes.
and then cluster sampling. We've done that.
Yes.
And then we did the non-probability. Under the
Probability.
non-probability, we look at the snowball sampling, purposive sampling, convenience sampling, quota sampling,
Yes.
and quota sampling. Yes, we have a lot of MCQ questions on that. So please, yes. So please, it's something you have to take very serious. Yes. So in fact, majority of the MCQ questions would come from the research methods, the research methodology, the chapter 3. Okay, the chapter 3 majority. Is that okay? Of the questions will come from the chapter 3. So some will come from the research design, which we've done, the study area, which we've discussed, the study sample, the sample size, we will do it. I taught you in statistics, but I'll take you through again. Then you would also have a lot of questions also from the sampling procedure. So no, when we say probability sampling, what does it mean? When we say non-probability sampling, what does it mean? What are the subtypes under probability sampling? That's where we have the simple random sampling, systematic sampling, we have the cluster sampling, and then we have the stratified sampling. Okay, and you should understand the meanings of all of them. Then when we say non-probability sampling, what is the meaning? What are the types? Okay, so non-probability sampling, convenience sampling, purposive sampling, quota sampling, is that, and the snowball sampling. What does it? Know the meaning and try to learn it with examples, because my scenarios are always framed with examples. So try to learn it with examples. So when you are learning, try and get examples. An example of a snowball sampling, then you read the example. An example of a simple random sampling, how would the example look like? Then you learn from the examples. Is that okay? Okay, so I think we are left. Have we done data collection instruments? Have we done data collection instruments? We've done data collection. Have we done data collection procedure?
No.
We've not done data collection procedure. Okay, so practically means we are left with this. Your class, we are left with this. Plus the sample size. So practically we are left with the data collection procedure, the data analysis technique, the validity and reliability, and then the ethical considerations. Practically your class, we are left with this 4. Is that okay? Yes, we are left with this 4. All right, so we would have a last meeting, which will be more like...
Please, can I say something?
Yes, please, go ahead, please.
Sir, please, with the data collection